Systemic hypertension. Sustained high blood pressure is known as hypertension. When blood pressure is sustained, for example, we check hypertension one time is same, and we check hypertension by the other time. For example, we check hypertension at p.m. It's 140 by 140 to 159 to that's systolic, and 90 to 99 that's diastolic is occur by the two same time. We call that is called hypertension. Blood pressure 140 to 90 at least two readings on separate occasion is considered hypertension. Hypertension is classified according to the recommendation of 7 Joint National Committee. Hypertension is the recommendation of 7 Joint National Committee. Classification of high blood pressure is measurement according to the GNC 7. What's a GNC? GNC say optimal normal pre-hypertension, hypertension, stage 1, stage 2, and stage 3. Optimal systolic and diastolic. Optimal 120 to 80, less than 130 to 85 normal, pre-hypertension 130, 139, and systolic 85 to 89 diastolic. Hypertension stage 1 mild. Three types of stages: mild, moderate, severe. Mild 140, 149, stage 1 systolic. 90 to 99 diastolic. Moderate stage 2 160 to 179 systolic. 100 to 109 diastolic. Stage 3 severe, more than 180 systolic and more than 110 diastolic. Yes, that is the stages of different stages of hypertension. But we normally check stage more than patient is nowadays stage 1 and stage 3. Even borderline hypertension, pre-hypertension may cause significant rise in stroke and cardiovascular death. Maybe pre-hypertension rise one of the most cause stroke and cardiovascular death if the hypertension is sustained. It's called systemic hypertension. What is the etiology of hypertension? Primary and secondary hypertension. Primary we call essential hypertension. Yeah, essential hypertension to call primary. 95% hypertension is no cause. Cause is not identified. Initial hypertension. And this form of hypertension is called primary or essential hypertension. The onset of essential hypertension is usually between ages 25 and 55. It is uncommon before age of 20. The onset of essential hypertension mostly it occurs in the age of 25 to 55. That's the essential hypertension age. And uncommon before in 20 age. Secondary hypertension. And about 5% of cases cause of hypertension can be discovered. 5% cases cause of the hypertension is discovered. This form is called secondary hypertension. Most of the patients are young and cause hypertension is usually renal failure, renal artery stenosis, or correction of aorta. Correction of aorta. Secondary hypertension is more likely in investigations. Mostly secondary hypertension is 50% cases of cause can be we can identify the cause of secondary hypertension. This form is called secondary hypertension. Most of the patients are young and cause of hypertension is usually renal failure, Renal artery stenosis, a correction of aorta, or secondary hypertension is more likely an investigation. That's the definition of primary and secondary hypertension.